Congratulations. Hopefully you've either hired a new employee or are deciding that you're going to hire a new employee. And you would think that your job is over. Yay, you got somebody new. However, the first week that the employee is there is just as important as the whole interview process. Sorry, but the job's not over. Many times when we hire a new employee, we just put them on the job and then go back to our day-to-day jobs and not really pay attention to that employee on the first week. But that first week is super, super important because this is truly the time where you can see how they do while they're in, everybody looks good in an interview and everybody, answers questions. Not everybody, I shouldn't say that. I just talked about how hard it is to interview. But, candidates do well in an interview that you consider to hire, but when they come in the office, that's when it really, truly matters to see how they do. So for that first week, it's even more important than ever to really pay attention to the employee, watch their nonverbal skills, watch how they communicate with other employees in the office, if they've got an attitude or not, if they're short with the other employees, if they communicate too much, if they gossip, if they, small talk, if they don't communicate enough, like they're not actually trying to get to know the other employees or they're not communicating with patients, like really watch them. Do they smile when patients come in the door? Are they standing up and greeting the patients? I mean, it's understandable to be nervous, of course, and you want to take it with a grain of salt, but really kind of watch their personality, especially after the first day or two or three, because this is going to become their true personality, or is their true personality. And it's much easier to determine that and handle that within your organization within their first week than it is a year or two after they work for you. So my point is not that I want you to have a lot of staff turnover or anything, but if the person's not going to fit, you're going to get the feeling and have the idea that they're not going to fit if you really pay attention that first week. And many times we hold on to employees for months, weeks, months, years, and then it's a lot harder to, let the employee go or to try to find somebody new because now you've gotten to know them and they've worked for you for so long and you know their kids and all of that. So in that first week, really, really pay attention to, is this person look like they're going to be a good fit or not? And again, if they don't have dental, you can train them on the dental, but watch the rest of their, if you've wanted somebody with good customer service skills and somebody who's friendly and outgoing, now that they're working for you, pay attention to see, is that truly their personality? The next thing you want to do is you want to make sure that this person is able to learn. So, and that they can follow direction, because the first week is the beginning of them learning a lot and following a lot of directions. So even if it's a menial task, make sure that you task this employee with some jobs to do so that you can make sure that they can understand, follow direction, and give you what you want. So even if it's a matter of, take all of these patient names and put them in an Excel spreadsheet alphabetically by last name and get it back to me by the end of the day. Give them something to do, even if it's not super important, but just to see that they can follow directions. I did this, I had a new employee a couple years ago who I had them do something like that. Take these patients and put them in, alphabetical order and get it back to me by the end of the day. 5 times this person came up to me to ask me, how do I get into Excel? How do I figure out which employees or which patients? How do I this? How do I that? Like, that was a simple, easy task, and this is just the beginning of having them do a lot of tasks for us. And that was a big red flag for me to say this person isn't really good at either troubleshooting on their own, following directions, maybe doesn't have the skill set that I thought that they did. And I'd rather find that out early in their time with us than a year or two later when I'm complaining because they don't know how to follow direction. So really, pay attention that first week. Spend some time talking to them after the first day or two. Sit down with them and say, how do you like the position? Getting some feedback from them, see if they're excited still, see if they're interested in it. Because that first week, and again, I'm not advocating, having a lot of turnover, but what I am advocating is not just putting them in their position and then letting them go and not really paying attention, because that a lot of what I hear office managers and doctors complain about with their staff was probably obvious and evident in the first week that employee worked there, but the doctor or the office manager thought, oh, well, we can change their personality, or we can train them, or they'll get better over time. Well, they're probably not. And again, it's a lot harder to handle that after the employees work for you for 6 months or a year or 6 years than it is in that first week. So don't just turn your back. pay attention, give the employee some tasks to do, make sure that they are good at learning, because there's going to be a lot they're going to have to learn in their new position, and you want to make sure that this isn't going to be a really hard process to get this person up to speed fast so they can be a good employee for your practice. So you're not off the hook yet. Really pay attention, and you should be paying attention all the time, but that first week is really, really vital to making sure that you've got a good employee that's worth keeping around in your office. And again, follow all your state laws and talk to your doctor about, what your doctor wants to do. But this is just my recommendation, not just putting them on their position and forgetting about them, but really make sure that you've hired the right candidate and that they're going to be a long-term fit for your practice.